All right, good afternoon, everyone. Thank you all for joining us here today for our presentation on the unspoken issue, mental health in our rural communities. And before we get started, I'm going to go over a few details. We will be asking our panelists questions throughout the presentation, so it's going to be structured with presentation and questions. And we will also ask your participation through a poll and by offering your thoughts and comments in the chat box. If you have questions at any point, please do put those in the chat box. Our Director of Education and Outreach, Caitlin Inslee, will be monitoring that, and then she will either pose those as additional questions to our panelists, answer you directly, or we will be following up with an email after this is concluded with answers to any questions we weren't able to get to. So this presentation is also being recorded, and it's going to be sent out to everyone who registered. And we will also be sending out a survey for your feedback on today's webinar. Lastly, in our follow-up email, we will include each of our panelists' contact information along with a resource guide. So here are four wonderful panelists bringing their expertise in rural mental health. First, we have Carol Bailey, who has been the Coordinated School Health Director for Marion County Schools for 14 years. She has been awarded the Connie Hall Gibbons Coordinated School Health Award for implementing the CSH program in our system and for securing funding for programs that address student health, wellness, and academic success. Carol has been trained as a mental health first aid trainer and held multiple trainings in our county and adjoining counties. Second, we have Amy Olson, who is a licensed clinical social worker, currently serving in the position of Director of Children and Youth Services for Ridgeview Behavioral Health Services. She has extensive training and experience related to children and youth in rural communities that have experienced trauma, as well as mental health and substance abuse issues. Next, we have Dr. Anna Taubenheim, who is the Clinical Director of School Services and a licensed clinical psychologist at Cherokee Health Systems. She has been with Cherokee since 2013 and has worked as a behavioral health consultant in multiple family practice and pediatric primary care clinics across the organization. She also has worked as a school-based therapist and currently oversees the clinical operations of Cherokee's school programs. Dr. Taubenheim is involved in training other behavioral health consultants across the nation through Cherokee's Integrated Health Training Academy. Additionally, she serves as a faculty member for Cherokee's Clinical Health and Psychology postdoctoral program, and she completed her Doctor of Psychology degree at Marshall University. And then finally, we are joined by Shelley Hall. She is the Senior Director of Blunt, Sevier, and Cocke County Services for the McNabb Center. Shelley received a Master's of Education and Counseling from Carson Newman College and has been with the McNabb Center for 18 years. She has supervised outpatient services in rural communities for the last 10 years, including services provided on integrated mobile health clinic known as Project Rural Recovery, which serves 5 rural East Tennessee counties. Through working with rural communities, Shelley has developed a passion for serving those with the fewest resources and recognizing the unique needs of each individual community. So thank you to all 4 of you for being here to offer your input. And then a little bit about our organization. We are the Mental Health Association of East Tennessee. We are a nonprofit organization dedicated to the promotion of mental health awareness, wellness, and recovery in our communities. Our programs are spread throughout the East, Northeast, and Southeast regions of the state, and we provide programs that educate and provide resources for early intervention, recovery, and advocacy.
Thank you so much, Emily. So to get started for today, we are going to be talking about mental health in rural communities, obviously. We're going to look at the national and state statistics. We're going to discuss some certain stigmas that exist in rural communities and how that affects the mental health, student and teacher mental health, as well as the stressors and barriers that rural communities face. And lastly, we're going to talk about some action steps for our rural schools and our communities, concluding with any questions that you may have. So nationwide, there are close to 60 million people, or 1 in 5 people living in rural communities. Within our own state of Tennessee, 93% of the land is rural, with 70 out of the 95 total counties having at least 50% of residents living in a rural area. Across both the nation and Tennessee, rural communities do have a higher risk for poor health outcomes, including mental health. And according to the CDC, individuals in rural areas die by suicide at higher rates than in the general population. The trends that we do see in suicide rates by sex, race, age, and ethnicity are magnified in rural areas. There are over 90 people living in a mental health professional shortage area, also known as an MHPSA, and most of those are rural. The suicide rate in those rural counties is 17.32 per 100,000 people, compared to 11.92 per 100,000 in the larger metropolitan counties. More than 1,000 rural counties don't have a psychiatrist, and by 2032, the USA is projected to see a shortage of at least 3,400 psychiatrists. Right now, at this moment, it would take 1,851 providers to eliminate the gap that exists in rural communities for mental health professionals. Mental health conditions are a risk factor to suicide, and with the prevalence being higher in our rural communities, combined with the severe gaps in mental health providers, we can see why there's a larger threat to the mental health. Looking at the mental health in our schools, in Tennessee, suicide is the third leading cause of death between the ages of 10 to 19. And 50% of all mental illnesses begin by the age of 14. According to the most recent Youth Behavioral Risk Survey, in the average Tennessee classroom of 30 students, out of that, 10 to 11 students meet the clinical symptoms of depression and other mental health conditions. 5 to 6 students have contemplated suicide, 4 to 5 students have planned suicide, and 3 to 4 students have attempted suicide. And in 2017, out of a total of 1,163 suicides in the state of Tennessee, 376 of them were in rural counties, which is approximately 32% of the entire suicides that year. And in that year, 75 of those people who died by suicide were between the ages of 10 and 19 years old. Evidence has suggested that rural populations have a more difficult time recognizing the symptoms of mental illness, and this does carry over into our rural schools because some schools lack access to resources and education on mental health. Something that's really important whenever it comes to mental health is stigma. And we want to break this down, basically figuring out how stigma relates. Stigma is a shameful and negative approach, perspective, or idea about mental health and what it means to have a mental illness. It is when someone views a person in a negative way just because they have a mental health condition. Some people describe stigma as a feeling of shame or judgment from someone else, but stigma can come from an internal place, confusing feeling bad with being bad. So we really see this play out whenever we hear words like crazy, attention-seeking, insane, dramatic, whenever someone is describing someone that has a mental health condition. Because whenever we attribute a negative word or a phrase to the symptoms of mental illness, we are furthering the stigma. This makes it a lot more difficult for people to reach out for help or to talk about the subject in general. People do potentially feel scared of being judged and feeling alone or isolated, which ultimately increases and worsens their symptoms and their mental health issues.
All right, thank you, Sarah. So that brings us to our first panelist question. We've gotten a lot of statistics and some background information. And I would like to ask you, Dr. Taubenheim, can you tell us how you see stigma playing out in the communities that you work with? And has the stigma been a barrier for you to accomplish your mission with that work?
Yeah, absolutely. And can you hear me okay?
Yes, we can.
Great, thanks. Just wanted to make sure. Yeah, absolutely. You know, I think it's been pretty well known that there's been just significant stigma around mental health in general for a long time. And we see what we call public stigma as well as self-stigma. And both of these things really impede access to much needed care. As you mentioned earlier, you know, the stigma around just seeking care when we use terms, the way that the public sees people who do have conditions like depression or anxiety, and when they use those very hurtful words and language, that really contributes to public stigma as well as self-stigma. And this is when, you know, people with mental illness are impacted by thoughts and feelings about themselves. And I think, you know, particularly in rural communities, we see a lot of this play out and really causes barriers to accessing care. So if you just think about, you know, in rural communities, a lot of times the people who we see in our clinic will say, you know, well, I know my family, my friends, they recognize my car. I don't want my car to be seen in the parking lot. And then in schools, when we are seeing kids in schools, one of the most common things that we hear is, I don't want my friends to know that I am in therapy. I don't want to get services through a school because I'm afraid that my friends will find out. So we see those barriers both coming to a clinic and then in schools as well. So it makes it really hard to provide services for the people who really need it the most. So there's this lack of anonymity, especially in rural communities. And just thinking about it, we wouldn't typically be embarrassed to go to our primary care doctor and obtain treatment for hypertension or diabetes and things like depression and anxiety, which are also medical conditions, though yet are embarrassing. And so the way that we really the way that we talk about this, the way that we see different conditions really has an impact. We've siloed out mental health and made it very different from physical health. And so, something that we can do is, the way that we talk about this, that, depression, anxiety are medical conditions just like diabetes and hypertension.
Yes, thank you so much. That was a very thorough answer. I think you really encompassed the idea of stigma in rural communities. I really loved your discussion on self-stigma as well. So we are also going to launch a poll for our audience just to get their input. We want to see what you all think about, do you think that stigma surrounding mental health is a problem in your community? So as we move on into our next slide, if you'll just answer that so that we can touch on it.
Okay, yeah, so while that poll is going, I'll briefly talk a little bit more about stigma and statistics. Dr. Taubenheim actually did cover some of the things, so that was fantastic. But yeah, whenever we look at stigma, navigating life with a mental health condition can be very tough, and the isolation, blame, and secrecy that is often encouraged by stigma can create huge challenges to reaching out, getting the needed support, and living well. Learning how to avoid and address stigma is very important for all of us, especially whenever you recognize the effects that they have. So we have some of those effects on the slide. This is going to be everything from people that do experience mental health conditions facing rejection, bullying, and discrimination. This can make the journey to recovery a lot longer and a lot more difficult. Mental health conditions are the leading cause of disability across the United States. Even though most people can be successfully treated, less than half the adults in the United States who need services and treatment get the help that they need. The average delay between the onset of symptoms and intervention is anywhere between 8 to 10 years. And suicide is the second leading cause of death of youth ages 15 to 24 in the nation, and the 10th leading cause of death for all Americans. And so stigma is a part of our culture, even in our rural communities. And so Dr. Taubenheim covered what self-stigma was, and that's extremely prevalent and very important. It's whenever we do see our mental health struggles as weakness, and it makes it harder for us to reach out. Many farmers and other rural residents have stated that they were taught to be tough and self-sufficient, taught not to complain and not to admit failure. Many residents have also admitted to feeling overwhelming shame and guilt if they do fail. And so another danger that this poses whenever it comes to stigma is that most do not even recognize their symptoms as mental illness, but instead contribute it to furthering that self-stigma. And so these are just some of the reasons that stigma impacts your ability to not reaching out to care. And another thing Dr. Taubenheim talked about was the threat of anonymity and your privacy issues. Since the rural areas do have smaller populations, like she said, you don't want someone to see your car. The privacy can be a challenge or a perceived threat. And so providers may be friends or associates, or they know you. And that fear of judgment that comes from stigma, the shame, or feeling like you're going to be weak, does cause a huge barrier whenever it comes to seeking help for mental health. And so some factors may cause individuals to be at a greater risk for developing a mental health condition. Those factors in rural communities may include family history of mental health conditions, chronic mental health conditions, lack of parental involvement or resources, social isolation, traumatic experiences, and past abuse. Other factors are environmental and situational. So these are going to include the local policies, community relations, and attitudes that exist. These risk factors can increase or protect an individual's mental health risk.
All right, so I'm going to go ahead and share our polling results real quick. It looks like the majority of us all agree that it is a problem or it's a serious problem. So that's why we're going to kind of shift gears and talk about action steps we can take in a little bit. But for this question, I'm going to pose this one to Carol first. What do you see as the main stressors and barriers that teachers and students in rural schools face that may be less common in urban areas?
First of all, I would like to say that our teachers in Marion County have done an awesome job this year teaching through the pandemic. We went into the year a month later than most everyone else did. And they did not know what to expect or what to do. So they have done an awesome job teaching this year through the pandemic. And I'm just very, very proud of them and what they've gone through and what they did. As this year has gone on, they're burnt out, they're depleted, they're starving for praise that says, we understand what you've been through, we do appreciate you, and they need to feel valued. So I think along the line of our mental health, that probably fits in a whole lot with what we're talking about today. But again, our teachers have done a very, very, very successful job teaching rigor and keeping the academic standards up like they should have been. And then we fall into testing week this week. And my question for our legislators, I guess, is why? You know, we're teaching in a pandemic. Why do we need test scores this week, this month, for this year? So on to the question of what do I see as the main stressors? A lot of people, the majority of people, I think, in our rural areas don't really understand what mental health is. In our schools, we need lots and lots of counselors, and our counselors are sometimes put in positions in the rotation of related arts where they actually teach classes and don't have the time to counsel students. Our high school counselors are test coordinators, and they're schedulers, and their role is actually hands-on with students is minimal. So I think a lot of times we don't have the access to the counselors that we need, and we also don't have the knowledge and understanding of what actually mental health is. Sometimes I think that with the mental health issues, they don't understand that sometimes medication is needed for our students. And that could be a problem also. The small town belief that if my child's going to counseling, there must be something wrong. I know there's nothing wrong with my child. And of course, resources, we don't have the resources. A lot of parents can't just pick up and drive to Chattanooga or to surrounding areas for appointments. I feel like our classroom teachers need more training in how to deal with students that have these types of problems that may be diagnosed and they may be medicated for. In school, they're trained to be teachers. They're not trained to be mental health counselors or social workers or whatever, and they're filling that role a lot of times even as parents. So sending them to the counselor's office is probably not always the best option. That's what our option is now, but our counselors are overwhelmed also. So I just think overall, we don't have the resources. We don't really have the understanding of what mental health truly is. And just the stigma is there. I know several years ago, I think 2015, we had the mental health first aid training that we tried to get into all the schools. And I felt like then that we were just at the tip of the iceberg with mental health knowledge. And I think now we're just kind of getting down past that tip of what mental health actually is for our students and for our staff. And I think if we ever get down to the middle of that iceberg or to the base, we'll be where we need to be with mental health.
I love that visual. Thank you, Carol.
Great. Okay. Thank you so much, Carol. Really appreciate that answer. So that is one of the things that we're going to start talking about now is the stressors that we have on our teachers and our students in the schools. Many stressors that teachers face are seen nationwide, obviously. However, in our rural schools, these stressors can be exacerbated and be made worsened. So these are going to be everything from meeting those performance objectives, the increased working hours, student issues with their behavior, interactions with parents, the lack of input and decision-making, as well as the salary and their additional roles and responsibilities. But whenever we do look at the unique stressors that teachers face in rural schools, we do see even more potentially harmful risks that exist to our teachers' mental health. This is going to be everything from more outdated facilities, unstable internet, students who face poverty, the lack of resources, like we talked about just a second ago, whether it be financial or educational, the limited professional development for our teachers, as well as the potential for low attendance and student apathy. Another threat and potential risk factor is the fact that there's a lack of community organizations and after-school programs. The recruitment and retention of staff, whether that be teachers or counselors, and just the physical location of the school. So it's more isolated, whether that be it's farther away from homes or farther away from the services that are needed. And looking at our students from a broader perspective, we do identify stressors that exist in all domains of their lives. So again, some of these stressors that they face are of course the same across the board, but many are unique to living in the rural communities. So at home life, the potential for a lack of parental involvement, abuse, neglect, and trauma, food insecurity, and especially poverty. Residents of rural communities are more at risk of living in poverty than urban counterparts. In 2017, 22.8% of rural children in the United States were poor, compared to 17% of urban children. And rural parents often work multiple jobs to make ends meet. We also have our students' school life. So this is going to be everything potentially from the lack of individual attention, as well as higher teacher turnover. We mentioned how that is a risk factor because of teacher retention. And if students do face higher teacher turnover, it does give the lack of stability that a lot of students need in that time of development. And of course, like we just mentioned, there is a lack of mental health resources. Rural schools cannot provide the same access to mental health service as schools in larger population areas because there are fewer resources available to implement evidence-based mental health services. And then lastly, we have our students' social life. So this is going to be anything like peer pressure and bullying, as well as their peers having apathy towards education, drug and substance abuse, and lastly but not least is definitely that social isolation based off of just the location of their community as a whole.
All right, so this next question, I'd like to start with Shelley. From your experience, what are the main barriers to mental health that exist in rural communities?
Absolutely. So I want to look at this question twofold. One from an individual's perspective and two from a provider perspective. And I think it's really important when you talk about rural communities to not compare two communities, particularly communities that are next to each other, because, you know, Cauca and Sevier, for instance, the issues that with individuals in Cauca are very different from the issues in Sevier. And so when we serve our rural communities, we're very much cognizant of being aware of those differences and not comparing to an individual. Because oftentimes that's very insulting to compare someone who's been born and raised in a rural community and they understand they have very few resources, and you compare them to another community that they view as having many resources, may not be as many as in our larger communities. But from an individual's perspective, they often come in to see us and they don't even know what services they need and how they can access them. So they're thinking that something is wrong, but you're not even knowing what that is. And so helping them navigate through what services are available to them, will their insurance cover those, is often a concern. And so helping to, when we first see someone in a rural community, just relieving all of those fears, helping them feel comfortable, providing a judgment-free zone for them, because they come on thinking that we're going to judge them,
everyone that we have seen in our more rural communities, particularly with Project Rural Recovery, where there are so few resources in these more rural communities, really feel that way. And so just helping them feel comfortable that, you know, nothing that is said comes with judgment. It's just, we're going to take from today forward and figure it out as best we can. And so that tends to, you know, alleviate any anxiety they may have in regards to seeking services, and them understanding that we're not here to take their children away. You know, in rural communities, there's this great fear of someone's coming in my home to take my children away. And so that's not our role as a provider. We're there to help support them and help them to keep their children and figure out what that looks like. And so that is very important in what we do. Continuum of services is a huge challenge, not only for individuals, but for providers. So the a good portion of the people that we see in rural communities often need a higher level of care that isn't readily available for them. And so how are we able to treat them in an outpatient setting to provide them the best care that they can, when we really know that they may benefit from a crisis stabilization unit or a detox facility if it's a substance use issue? And so figuring that out to make sure that they're safe, one, but if I recommend them to a higher level of care, will they be compliant with that? I know they can be compliant with this because they made it here today, but what will that look like for a higher level of care, even if that is available to them? But we know for some of our rural communities, a higher level of care is 2 to 3 hours away. And so that is overwhelming oftentimes for the people that we see. And also, people identify the problems that they have. They don't want to share those. Those are generational issues in their family. A lot of times they don't see them as issues. They've learned to adapt to those issues. And so helping them understand, like, you know, you can live a more healthy life physically and mentally, and getting them to a good place. From a provider standpoint, and Sarah alluded to this earlier about the shortage with practitioners, we see a huge staffing shortage in rural communities. It is ideal if you can find people who live in that community who can be those clinicians in those communities. We know that often doesn't happen. And so when you live there, you understand the population, and you there's a drawback to that because you often know everybody too as well. So being cognizant of that is really important. And getting, like I said earlier, getting people to the appropriate level of care is a huge challenge in rural communities. And then identifying the type of care that they need. Like I said, you know, one of the things that when I'm assessing a child, oftentimes I see them and I think they would have benefited so much from early intervention prevention services. You know, I just wish they had gotten occupational therapy at 2 and 3 years old, and then we may not be seeing these behavior issues at 6, 7, 8 years old. And so that part in my job is really challenging. I feel horrible that that was not an option for them in their community, or that they could afford it. And so knowing that on the front end, but then looking at it like, okay, that didn't happen in the past, but what can we do today? So, you know, those are the things that I see as the main barriers when working in rural communities, and as someone living in a rural community that may face.
Thank you so much, Shelley. Thank you for breaking that down into those different perspectives too. I think that was really valuable.
So yeah, that was a fantastic answer. Thank you so much, Shelley. And so yeah, we're talking about barriers now. And one of those major barriers is going to be the access to mental health resources. So like we kind of just touched on, 95% of rural mental health professionals have stated that they cannot meet the needs of their communities. One of the issues that this causes is that it does lead to wait times that can take weeks or months. And for someone that is in crisis, or an individual whose mental health is quickly deteriorating without intervention, waiting that long can be very dangerous, potentially life-threatening. Another consequence of the lack of mental health providers is that people are more likely to see primary care doctors for their mental health conditions, approximately 60%. So Shelley did just touch on this as well. Whenever, obviously some care is better than no care, but primary care does not necessarily provide the specific treatment that may be needed, especially whenever it comes to more intense treatment. Many healthcare providers choose not to work in rural areas due to billing restrictions and other challenges that exist with lower reimbursement rates. And so these issues can make it really hard to recruit and retain mental health professionals that serve that more specific care. With the higher rates of underinsured and uninsured individuals living in rural areas, we do reach our next issue for access to mental health, and that's going to be the affordability of it. Many insurance companies and programs do not cover the cost of mental health services in general. So therefore, even if the services are available in those communities, it may be too expensive for many people. And lastly, is transportation. That's going to be a barrier. And we briefly talked about that and touched on that earlier. But with fewer providers in the community, people may have to travel farther distances to reach the care that they need. And most transportation in rural communities is provided by personal vehicles. There's a lack of public transportation, and that does result in a lack of access to reliable transportation if someone's having car issues or anything like that. And so without that, transportation care does become inaccessible since there isn't prevalence of public transportation. The social isolation is a risk factor in itself for mental health conditions. And since rural communities are smaller, more geographically isolated, individuals are at a higher risk of both isolation and the exacerbation of their mental health conditions. So there are certain factors that can protect a rural community from distress and make a community less likely to experience an increase in the severity or prevalence of mental health conditions. Some protective factors may seem very self-explanatory and obvious. So this is going to be having more economic security, providing proper parental supervision, and having a more stable home environment. But others are more big picture. So these are going to involve family and community support in learning social coping or problem solving skills. So we want to discuss next what we can do to make as a difference as individuals, schools, and as a greater community.
Yes, so this is going to be my favorite part of the presentation where we really focus on the action steps that we can take. So Amy, I would love to have you answer this question first. What ideas do you all have for action steps that individuals can take to help improve rural mental health by starting small with their families, friends, or workplace?
Yeah, thank you. So I really love Tennessee's initiative to focus on adverse childhood experiences, otherwise known as ACEs, and really kind of looking at how that impacts early development of children. And we all know with children, the best way usually to support them is to support their families. And so people spoke previously, about getting those adults into the needed services for mental health, substance abuse. And that could just be a great role model for children, that your parent needed help, they sought services, and hopefully getting a more stable family. And then also, we're talking about rural communities. One of the wonderful things is that, like you said, everybody does know each other. So, people really taking the initiative in families, if a family has, a new baby, to kind of just do those rural, home style things like taking a meal over, offering to watch the children, taking the other siblings out, things like that. And then also with the ACEs study, what we've really learned is just one caring adult in a child's life can make a huge difference. And it doesn't have to be the parents. It can be another family member, a neighbor, a teacher, a coach, anything like that. So just kind of everybody remembering that you can still make a difference in a child's life just by being that caring, consistent person. I think friends, we've all learned during COVID the importance of making those contacts, actually planning for them, whether you do it weekly or monthly, but just not letting, a whole month go by that you've never picked up the phone and reached out to someone, and just, kind of doing the fun activities, getting together at local parks, a book club, a sports team, things like that. And that goes for the youth as well. Sometimes it has to be the parent who initiates that, but making sure that they have those activities. And then workplaces. I mean, that's a wonderful example as well of what individuals can do, just helping their employees with that work-life balance. A happy worker is going to be more productive, so it will pay off in the end. So doing simple things, you know, flex time, flex schedules, working remotely capability, appropriate trainings for your workers, supports, and then as much as possible for workplaces to offer mental health services. Another wonderful thing in rural communities are their faith-based agencies. So really having them helping out with, you know, providing that support to families, to youth, in whatever way possible. And then finally, you know, our rural communities in East Tennessee are some of the most beautiful places in the country. So just taking those opportunities, get outside with their friends, their families, the hiking, the camping, the fishing, you know, just all that we have at our fingertips.
Thank you so much, Amy. I think that strengths-based approach is so important. Does anyone else on the panel want to weigh in on this question or have any other thoughts? You covered it all, Amy. Thank you. All right, then we'll move on. Thank you so much.
Great. Yes, that was a fantastic answer. And we'll dive into a couple of more different things that we can do as individuals, from everything from smaller things to bigger things that require a little bit more time for us. The first thing we want to do is be conscious of our language. We talked about this with stigma, some of those words that get thrown around whenever it comes to mental health. Intentionally changing your language and checking yourself to make sure you're not using those harmful words can be really, really helpful. So staying away from words like psycho, crazy, dramatic, weak, whatever it may be that you hear other people describing mental health as, making sure that we ourselves are not saying that to ourselves or to other people whenever we're struggling with our mental health. We also want to pay attention to when we may misuse mental illnesses as adjectives, such as saying like a rainy day is very depressing or the weather is bipolar. Sometimes this can further the stigma as well. So instead, we want to try and choose more appropriate words for even just describing things. We don't want to use mental illnesses as adjectives. Talking openly about your mental health. So share your own emotions and normalize talking about your mental health, whether this starts to be a conversation you have with your children, your spouse, your friends, your families, if your teachers, having it, you know, more open to your own mental health experiences in your classrooms. It can be very, very helpful. Another thing we want to do is show compassion for those with mental illness. So show compassion for yourself if you are struggling with your mental health, and also making sure that we are supporting our friends, neighbors, family members, and peers who may be very comfortable and very open with talking about their mental illness. We want to show them that compassion and support, check in on them just like we would want if someone had a physical illness, or even like Amy was saying, if someone has a baby, you go over there, you make sure that they have food. If there's a death in the family, that's something that, you know, we make sure we check in on people, and we want to do the same thing if we know that someone has a mental illness. And the last thing that we can do as an individual is educate ourselves and educate other people. There's a lot of power in accountability. And if you help hold each other accountable, you can correct people in a caring way whenever you hear them talking negatively about mental health, or you hear them talking negatively about someone else that has a mental health condition. And you can hold yourself accountable by working on showing your own self-grace if you're living with a mental illness or you're struggling with your mental health. So you want to refrain from talking down on yourself, and don't allow yourself to hide behind that self-stigma for fear of what other people may think.
All right, so this is the discussion that I really want us to spend the most time on, and really just have an open discussion as a panel to really give our audience action steps that they can take moving forward, especially audience members that have some role in the schools or in other organizations. So the first question I was going to pose to Carol and Amy, because I know you both have some experience working directly with schools. So the first is, what do you all see as the most important steps that schools can take at an administrative level to improve the mental health of their students and staff?
I can start. One thing I think, again, just like I said with focusing on the parents first, you need to focus on the teachers and staff first. Like Carol said, this was a year unlike any other, but our staff have always been stressed. So really administration kind of as much as possible focusing on providing the trainings for staff on mental health, trauma, ACEs again. You know, most of these people went to school for teaching and they did not get the mental health subjects, but they're bombarded with it every day. So as much as possible doing that. I've heard some school systems do check-ins with their staff and even a buddy system. So if the staff really just needs a break, maybe they're being triggered in their classroom, they text the teacher across the hall and they get that break. And then just monthly activities for the staff, you know, again, reach out to your community, see if restaurants would do luncheons, will businesses give coupons, discounts, anything like that. You know, just to kind of show our staff that we know that they're struggling, we care about them and trying to help them as much as possible. And I also heard a school in Roane County, and on one of their teacher and services days, they did a scavenger hunt. So it was just a fun activity, you know, trying to make, you know, teacher and service days, I'm sure are probably not the funnest, a lot of training and everything, but as much as possible, just to kind of give that enjoyable, you know, time for them. And then the same thing with kids. I think morning greetings for students are imperative. I don't think any child should walk into a school without being seen by one of the school staff. It's just a great way to catch anything before they get into the classroom. And then in the classroom, often it's as simple as meeting their basic needs. Is anybody hungry, tired, upset? You know, if you could just give a kid a protein bar and eliminate, you know, a meltdown, then that would be perfect. And then also just anything we can do in our classrooms to support the children, calming corners, sometimes the lighting, flexible seating is such a wonderful thing. And then overall in schools, if we could have wellness rooms for students and teachers as well, that would be really helpful.
Thank you, Amy. Yes, I think everything that you mentioned is super helpful. And the importance of building relationships. Some of the things you said just seem so small, but just that daily building of positive relationships is so important. Carol, would you like to weigh in?
Yes, I went with it more on the administrative side. And I thought maybe we as a system could put more money in our budget. We have, at this time, we don't have a social worker. We have that position open, but we only have one for our system. So I think we need more social workers and counselors in our system. And I think we also need to, as the administrative side of it, needs to approve and utilize the services of our community partners, such as Mental Health Association, and let those folks come into our schools and teach the 101 to our students and to our staff, and refresh our teachers on ACEs, so they can have a better understanding of what our students are dealing with daily and how to help them. And I loved Amy's more positive thoughts on things of what we can do for parents, staff, teachers, and our students. And so I'm going to encourage that this year also for our teachers. So thank you, Amy, for those words.
Thank you, Carol. And before I move on to the next question, Shelley or Dr. Taubenheim, did you have anything else to add for school level? All right, then let's move into something that might be more up your alley. How could an entire community work together to improve the mental health of its members?
So I think, you know, one really big thing is advocacy. So advocating with policymakers to focus on broader economic strategies that are designed to increase funding and resources and to schools, but also other community organizations to help develop mental health services. And, you know, right now we are in a very reactive system. So I think that somebody addressed this a little bit earlier, that, you know, we wish we could see kids when they're much younger before these problems start versus 8, 9, 10 years old, or even as adults after these problems have been ongoing for a long time. So we really need to shift from a reactive system to a proactive system. And so part of that is advocating for embedding mental health services into our community organizations, into primary care, developing and funding more integrated care programs. We go for well child checks, starting at birth. We go for frequent well child checks. And so we need these mental health well child checks as well, and really focusing on prevention, doing a lot of early screening, early intervention, and really embedding these programs into our schools and community organizations. We also really need to advocate on a community level for increasing access to services and addressing health disparities. We really want to activate our community leaders to help reduce stigma. We've talked, a lot about the way that we as individuals can help reduce stigma. We need to really promote shared accountability for mental health. We also need to really pay special attention to populations that are more at risk for mental health problems. So reforming the way that we address things like homelessness in our criminal justice system, which we know, in those populations, they are more at risk for mental health problems. Just reforming the way that we respond to mental health crises in our community. We really want to work to enhance the knowledge and attitudes in mental health, and that can be at the school level and then at the entire community level as well. So I think, advocacy, talking to policymakers and talking to those people who are making these decisions. We need more funding. We really need to embed mental health services into our entire community.
Pass it to you, Shelley.
Okay, so I, being in Sevier County for the past 10 years, I really found it was my place to find as many community meetings that I could possibly attend and attend all of them, and not just once or twice, but every single month. No matter if I walked away and felt like, wow, we really made a difference that day, or it really didn't seem like we did a whole lot, I went to every single one, because commitment is key. Everybody's got to work together to make it happen. It's not a mental health agency's problem to fix. It's not law enforcement's problem to fix. It's not the education system to fix. Everybody's got to work together to make an impact. And so if I'm not able to attend, I have a staff attending, because it is that important for us to be able to say, like, for someone to present a family and to say, I don't know what to do, and us to be able to provide a resource. And so it's really important that providers, individuals, stakeholders make a commitment to making change, because a lot of times people will want to get on, quote, bandwagon of being helpful, but they don't want to put the time or commitment into it. And it takes that commitment to really make a change. And yes, it takes time, and it's for agencies, we're short-staffed. But at the end of the day, in order to make an impact in your community, you have to find a way to prioritize that, whether it's churches or agencies or whatever it may be. It's really, really important that people identify it's important enough for us to take the time to invest. And, you may walk away in your agency or your church or whatever may not benefit from whatever is provided at that meeting, but it's not all what you get, it's what you can give. And so you really have to come at it from a perspective of that in whatever community you're in. And a lot of our communities don't even have, one meeting. They may have one meeting a month, health council or whatever it may be. But it's so important to prioritize those so that people know who you are, that you care about their community, that you have a place at the table, and you want to make an impact. I think is just so, so important. I can't reiterate enough that commitment to making it happen, because I understand, everybody has a lot to do. But if you want to see change, you have to be able to prioritize those things so that people know what you have to offer your community. And then if the resource doesn't exist, how has everybody figured that out in the past and working together to make it happen? And, another key to that is find the people in your community who can make things happen, whether it be judges, whether it be the mayor in that community, whether it be law enforcement, whoever it is, and speak with them and kind of get a backing for that, because everybody wants to improve the health of their community. I don't think anybody's denying that, but how do you make that happen? And sometimes as an agency, we don't have a platform for that, but we will find out who will and see if that's something that they support. And then they can kind of take that and launch it and see who they can bring together to make a change. And a lot of times, there's not money attached to this. You say we can't afford that. Well, oftentimes it doesn't take money. It may be something that people are already doing. You just didn't realize that, each had a piece of this puzzle. And if you bring everybody together, you've completed the puzzle and you've made a huge impact. So commitment, I just always say, just commit to it, figure it out as in whatever entity that you're at. Like I said, church, agency, law enforcement, whatever it might be, and just do the best you can to prioritize that.
Thank you, Shelley. And I think it just goes back to what you mentioned at the beginning, was how close-knit rural communities can be. Mm-hmm. And so that just allows for more of those partnerships to be created. So I love that. All right.
Yes, thank you so much. So you guys covered a lot of the stuff that's actually on the next couple of slides, so I'll try and make them brief. But we just outlined a couple of things that we think would be great action steps. The first one is going to be for our school action steps, and we're going to talk about our teachers first. So giving our teachers the support they need to model healthy behaviors for their students. So this can be everything from improving the work-life balance of your teachers, telling them, to try not to answer emails outside of work time. I'm sure every single one of us is guilty of that. Making sure we're opening a very encouraging daily self-care time for our teachers, as well as really focusing on our teachers' accomplishments. Carol, I love that the first thing you said answering your question was how awesome your teachers have done this year. And that is so important for us as administrators and working in schools, that we're acknowledging their accomplishments and their hard work on a regular basis. We also do want to offer those teacher in-service trainings on how to care for their mental health, as well as support the mental health of their students. So sometimes this looks like evaluating and providing training to support the mental health needs of students, looking at the prevention, early intervention, immediate response, and long-term support that the teachers or the school has in place for students. And lastly, getting creative with different realities for teacher retention. Shelley, you mentioned earlier not comparing counties, and I think that that's really important, because just like mental health, it's not black and white, right? Everything's going to be different for every area. So teacher retention is going to look different for all of us. Some of us may have the ability to offer salary incentives, but sometimes we have to think about things like on-the-job training, accessing coaches or mentors in the school, working on our school cultures and making sure it's more positive. Some places even have the ability to offer childcare through faculty contracts, or student loan forgiveness through different federal programs that you can apply to. And then next we have supporting our student mental health. And some of these answers were touched on as well, both in the classroom and at the administrative level. Amy, you mentioned how important it was to have teachers or someone greeting students whenever they're walking into the school. And just like that, I think it's also a really good idea to have a part of the day where you have self-care suggestions or mental health minutes in the school. So it can be like 5 minutes in the beginning of the class, it can be in the morning announcements, and it can be something as simple as telling them a new idea each day to improve their mental health or their self-care practices. So writing in a journal for 5 minutes, or writing down something they feel stressed out about. Sometimes announcements can be like, it's beautiful outside, try and go on a walk or spend time in your backyard, anything like that, to kind of just make it known that mental health is something that needs to be taken care of each day. Some schools have even done competitions and had students take daily self-care activities like on a tracker. And that can be really, really effective as well to build healthy habits. Just like our teachers, we want to make sure we highlight the strength of all of our students, even those that are performing at a lower level than you would like them to. So it's good for us to make sure that we're supporting them in the classroom. Another great idea for schools to do for their students is having a yearly screening. We're going to throw some links in the chat box, and we'll have it in the resource document at the end as well. But there are free screenings that exist for both alcohol and drug use, as well as regular mental health check-ins. So those are really easy and they're free, and they're just a great way to at least do it once a year with your students to make sure that, you know, you kind of know where they're at and they know where they're at with their mental health. Also, education programs. We do have a mental health 101 program that is free, and it is for middle and high school students, where we teach them the basics of mental health, self-care, how to recognize when themselves or a friend may be struggling with their mental health, how to get help, as well as suicide prevention in 8th grade and older. So having those education programs can be really, really beneficial for our students, because sometimes that might be the first time they've ever heard about mental health. And then lastly, there is potential for you to apply for grants that bring mental health professionals into the school. Funds do exist to hire your own social workers, psychologists, or other licensed professionals to work directly in your district, or contract them with an existing mental health agency. So that's really good to know about as well. And then next, we'll talk about our community action steps a little bit further. Changing the perception of mental health often starts with the individual, then it moves to the families, then the workplace, the schools, and ends with the community leaders, who are then equipped to maintain formal and informal community education efforts surrounding mental health. So we want to improve our community education, doing everything from trainings to reduce stigma surrounding mental health, promoting a positive mental health environment. Sometimes these can be formal classes regarding constructive mental health promotion, or it can be just informal conversations between community members. Another great idea is to try to create community after-school programs that not only provide academic enrichment, but also life-building skills like self-care and mental health, as well as positive relations outside of school hours. And it can also be a really critical resource for working parents, and in many areas, federal funds are available. There are even some places where this is done through the church. So those community after-school programs can be really beneficial. We want our community to be better connected, and so we want to work to promote that connectiveness. So planning events and social engagements open to all community members, no matter who you are, it may really help to foster a general feeling of safety and acceptance. And lastly, of course, we all know that we want to expand our access to mental health care, right? So this is going to be recruiting and trying our best to maintain a mental health workforce. There are different strategies out there to recruit more providers, whether it be higher pay and perks, rural residency programs, or loan repayment options. There can also be non-traditional mental health roles, such as peer support worker programs. This can elevate stories of any community member who have personally experienced mental health or substance use conditions, and they use their stories of success and recovery to help others and relate to their neighbors. And lastly, you can start your own support groups at the end of the day. This has been done among many rural communities, and it does allow people to share and process their struggles together. And so as we all know, and we have thoroughly talked about today, this is a topic that doesn't get nearly enough attention. And we are so thankful to our panelists for sharing their ideas, their thoughts, and expertise with us today. And thank you so much to everyone who has joined and has registered for this webinar. We are going to go over some of the questions that we had. We'll probably have a little bit of time. But just to let you know, we will be sending out a follow-up email with a link to this recording, a resource document, and all of our contact information. And any questions that we don't have answered will be answered in the resource document and the follow-up email to be sent.
All right, so just with our last 2 minutes, I'm going to go ahead and throw out one of the questions that we actually received from someone ahead of time from Linda Summit. How do you see the changes of urban influx affecting mental health of the rural communities? Any thoughts on that? The idea, I guess, of more people moving to urban areas, how could that affect rural communities?
I'm sorry to interject, but I took the question as meaning more people from urban areas are moving to rural areas as remote work becomes more available to many, and living in rural areas tends to be more affordable than living in urban areas. So that's what I took it as.
Thanks for clarifying that, Caitlin. Anyone on the panel have any thoughts behind that?
I think just helping diversify rural communities is always going to be a positive, you know, bringing different ideas, different, you know, ways of doing things. There obviously might be some resistance, you know, in the beginning, but hopefully it will just add a different perspective, and maybe even new business ideas, new growth opportunities for the rural communities.
Thank you, Amy. Dr. Taubenheim, were you going to weigh in?
Yeah, I was just going to say, you know, one thing I think it continues to highlight just on the other side is just that we still need providers in our rural areas, and we still have these massive provider shortage areas. We also have, you know, the issue of oftentimes in rural areas, we see issues with not being able to provide culturally sensitive care, and for patients who are not able to access culturally sensitive care in rural areas. So I think that's going to continue to magnify that, and just the need for providers in general, but also providers who can provide culturally sensitive care and evidence-based interventions to address mental health conditions.
Thank you so much to both of you for weighing in on that. We have a few more audience questions that we will be following up with via email when we send out our resource guide. But thank you to everyone who joined us today. And we also do have a survey. If you have time to please complete that and give us some feedback on what you thought about this presentation in this webinar. And that is in the chat. The link is right in the chat box. And thank you to all of our panelists. We're so grateful to you for spending your time with us for this hour. And thank you to all the participants. I hope everyone has a good rest of your day.
Thank you. I enjoyed it.
Thank you, Carol.